Hey there. Integrative health. What does it mean? This is the model of health that Front Porch Nurse is built on and that research has shown works best for our human skin sacs and our minds. And what it means is there's Western medicine, which is what we have in the US primarily, and it's doctors and all the other healthcare pros who diagnose illness. They focus on sickness and trying to get rid of that sickness in them at the time, and they do that with typically medications and surgery. There's nothing wrong with getting rid of illness if it can be fixed at the time. But what affects us right now are chronic diseases, which take a long time to develop, and then they're with us pretty much for the rest of our lives. So it works better if we manage those with lifestyle changes, with other complementary treatments. Complementary treatments now is what part of what we used to call Eastern medicine, which is includes like balancing the body systems, herbs and other natural remedies. But complementary treatments also include all sorts of other things like body work, massage therapy, energy work, aromatherapy, reflexology. What do you call that when you stick the pins in you? Acupuncture, acupressure, meditation, like tons of stuff. There are lists and lists of things that are considered complementary treatments. Looking at someone as if they are a whole person, which they are, and their mind is connected to their body. So, mental health, physical health, all of us. The best way to get function for as long as we can, which remember is called healthspan, and to feel as good as possible in our skin sacs is to use integrative health, which brings all of these treatments and therapies together. And you use what works best for you. Well, to figure that out, you're going to have to try some different things and keep track of what helps and what doesn't. And that's fine. You can totally do that. You've done way harder stuff. What else about integrative health? Oh, prevention. Integrative health focuses on prevention. So if you don't have a certain type of chronic disease yet, and the big three chronics that take us out in old age are heart disease, which covers a whole bunch of different stuff, cancers, and neurodegenerative diseases like Alzheimer's and dementia and Parkinson's. Okay, so those three take us out when we get old. But if we start now, if you haven't started yet, if you start now paying a little bit more attention to your health, you can delay, if not avoid, those problems. Those problems are not inevitable parts of aging. Do not be fooled. Do not listen to big lies from big pharma. Oh God, I gotta watch out what I say on here, right? We can avoid a lot of debility, pain, and just going downhill. We can avoid a lot of that. This is the message I'm sharing. We can do better for ourselves, even if your doctor does not have time to help you with that and tell you that. I will help you with that and tell you that. And I'm actually packaging all of this stuff together in a method called the 802H health span method, because we need to educate ourselves with actual research based information. We need to figure out what works best for us, because I don't know about you, but I want to be around for a long time. I have a lot of things I want to do yet besides taking care of other people. And so that is the plan. Come along with me if that is your plan too. Subscribe, like, share, click, click. All right, that's it for today.